demographic questions. We're now going to transition into our first topic. So if our panel one can join us on stage. So this first topic that we're going to be working through as a group. So panel one panelists, please come on up. So our first topic that we're going to be exploring today is living with Alport Syndrome, disease symptoms and daily impacts. In this topic, we're going to be discussing the symptoms that you experience because of your condition that have the most significant impact on your life. In addition to learning about what those most burdensome symptoms are, we also want to understand how your disease experience impacts activities that are important to you, such that you either cannot do them at all or as fully as you would like. As we discuss these different symptoms and burdens, we want to have an understanding of how they vary over time, so day to day, week to week, perhaps even month to month, as well as how they've progressed or changed over the years. And lastly, and importantly, we want to understand what worries you the most about living with Alport Syndrome. And so, to kick off our discussion on this, we have a wonderful panel. Our panelists are Gabby, Phil, Bryant, Janine, and Sharon. And Gabby will actually kick it off for us. So go on ahead, Gabby.
Hello, everyone. My name is Gabrielle Swaza. I am 15 years old, and I live in Richfield, Minnesota. I would like to ask each of you to imagine how it would feel to gurgle water and cough at the same time. Once you have this image in your mind, picture waking up in the middle of the night completely cut off from oxygen, and all you can physically do is that. Now you know what my life has been like for the last 14 years. Due to leiomyomatosis, my esophagus got so large it blocked my trachea, making the simple task of clearing my throat a scary event. Like any condition, Alport Syndrome has branches, and I'm that small branch at the top that no one really knows about. I have Alport Syndrome with diffuse esophageal leiomyomatosis. My whole life, I've been in and out of hospitals, slowly watching my esophagus get larger, my trachea get smaller, and my breaths get shorter. It was hard knowing I couldn't do the things I loved, like softball, swimming, or anything that required breathing, without the fear of choking. I couldn't eat some of the normal foods kids loved, not to mention I got less sleep and a lot more stress. My symptoms started when I was 17 months old. Since then, I've had many tests to see why my body kept changing. Every time I looked at a scan, only to see my esophagus was getting larger, my hopes slowly got smaller. I actually never knew I was different until kindergarten. I mean, I looked the same, and I could basically do the same things as everyone else. I realize now that if you have a condition no one can see, it's hard to get any sort of help. I didn't know anybody who had the same issues as me, so I felt isolated, like a boat in the middle of the ocean calling for help, but no one knew it was there. For 13 years, I was a mystery. No one could explain to me what was happening with my body or why it was happening. Through all the fear, I was determined to live as normal as I could. I can sit here and try to explain to you all that I've went through, but I'm afraid there isn't enough time and there isn't enough words to explain the fear I have faced and the determination I've had to develop along the way. When all this started, my choking symptoms occurred once in a blue moon. They progressed to once or twice a week, and towards the end, it could happen multiple times a day. A lot of times, I wound up turning blue as my body struggled to find oxygen. In the last year, it got so bad, I ended up having 2 seizures and wound up in the ICU for what felt like an eternity. I was told I had less than 2 years to live, or 2 years to fix my esophagus, or there would not be a me to fix. While in ICU, the problem remained, that the cause of my issues was still completely unknown. However, new issues were discovered, such as my kidneys weren't functioning 100%. Luckily for me, the renal doctor assigned to find out what was up with my kidneys made the connection between the kidneys and the esophagus, and suggested I got a genetic test. 2 weeks later, I received a positive test for Alport Syndrome. I can honestly tell you I was in total disbelief. I had been misdiagnosed 5 times, so I had no reason to trust yet another doctor. They assured me that this was the final answer. After that day, my life got flipped upside down. I began trying to fix the life I was given and not the life I chose to have. I think everyone's biggest fear is death. Nobody wants to die because it's such an unknown thing. Nobody knows where we go when we leave this physical world. And from such a young age, I've had to worry about death. I've had to worry about my body just failing me. In 2017, when they told me I had 2 years to live, I was scared. Those 10 words brought so much more fear into my life. Before my diagnosis, my only worries were my esophagus and breathing. Now I have to think about my kidney health, my hearing, and maybe even my vision. Luckily for me, my kidney function is still very high. And knowing more about Alport, I'm still afraid, but I feel a lot more safe knowing I'm not a complete mystery. My esophagus is now completely gone, and it has been surgically removed. My stomach was pulled up to take its place. After 8 months of recovery, I can eat almost normally again, and of course, with the ease of breathing. This new anatomy has left me with the need to eat more frequently and in much smaller amounts. I also have to be careful about what I eat and drink, as acid reflux has become a much bigger component in my life than before. With the new ability to breathe easier, I've been able to return to playing softball. I have also been able to act as almost a normal teenager. It has also reduced my fear of suddenly not being able to breathe. But now I worry about the possibility of not seeing you one day. I worry about the possibility of not hearing you one day. And I worry about the possibility of having to sit in a room for 6 hours straight, having my blood filtered through a machine, because my body can't do it itself. My body can still fail me at any minute, but I've learned if you focus on the worries in life, it isn't very enjoyable. So right now, I want to focus on how much I've grown, and I want to tell you how proud I am to be a born special, how proud I am to be 1 in a million, and how proud I am to be a born genetic mutant. Thank you.
Good morning. My name is Phil Seymour. I'm a configuration manager for an in-flight entertainment company, and I live in Orange County, California. I've lived with Alport Syndrome for over 55 years. My missense mutation of the disease has meant that for over half my life I was completely unaware of my condition. Historical misdiagnoses and lack of medical advances have contributed to my not monitoring my kidney health until I was in my 30s, when my hypertension and proteinuria became clinically obvious. A biopsy confirmed the diagnosis of X-linked Alport Syndrome when I was in my latter 30s, which was later confirmed via a genetic test. When I was diagnosed with Alport Syndrome, my kidney function was still well over 50%. However, it has declined steadily over the years, dropping to the 30% range in my latter 40s, and the last year dropped below 30%. For years, nothing had really changed. See the doctor once a year, take my meds, cross my fingers. Thankfully, my recent participation in a study trial for Alport Syndrome has increased my kidney function back above 50%. Living with Alports has forced my hand in many important decisions in my life and in my family. In the 90s, my wife and I were building our family one precious child at a time. Due to the fear of raising a daughter suffering from a devastating kidney disease, I made a difficult decision to stop growing our family after 2 children, both boys. It was not a popular decision in our house, and we still imagine how our lives would have been further enriched with the sound of a little girl's voice in our house. We decided not to tell my 2 sons about Daddy's disease until there was a large complication or when they reached adulthood. They were in college before they knew of my condition. I felt awful telling them so late, but my wife and I thought it was best since there's no cure for Alports. What could they do except worry? I've avoided telling others about my disease, except family members and the closest of friends. It isn't that I'm ashamed of living with Alports, rather I fear loss of insurance or employment. I've been unemployed before, and with pre-existing medical conditions at risk of being dropped by insurance companies, the fear is real. My life has been impacted by multiple symptoms of Alport's, including hearing loss. I've recently been told I have up to a 20% loss of hearing at key frequencies. This has made me withdraw from active conversations, from enjoying entertainment, and made it more difficult to perform my job. For my entire life, I've always looked at the mouth of the speaker rather than into their eyes. It's not just a preference, rather, it's a necessity. My wife and I have a standing joke that when she says something softly to me, she's saying that she loves me. And I know it's true. I've given up understanding quiet sections in movies. Instead, I watch the actors' expressions and the cinematography and the musical passages to get a gist of the plot details, and I ask my family questions afterwards, and I've lately given that up too. Oftentimes, I misunderstand someone at work, make a calculated decision, only to be told I heard incorrectly, so I must apologize and start over. My team has begun to text me more often now instead of talking to me directly. I now sit quiet in meetings when I miss sentences, and last month I had a customer indicate to a comrade that I was hard of hearing through a gesture, and I felt awful as the man repeated the question to me as my coworkers waited. Will I still be relevant in my company in 5 years? How can I support my family if I can't stay unemployed? Another symptom of Alport's that has impacted my life is gout. There's still a stigma attached to gout. It sounds like an old and a dirty disease. I always tell others, I hurt my toe. I first got gout almost 10 years ago, and I thought I had surely broken my toe as I had never experienced such intense localized pain. For many years, I didn't have any symptoms, but recently I've had flare-ups once or twice a year, which can last for multiple weeks. And when that occurs, I can't walk around the office, I can't work in our yard, my wife and I can't visit museums and the gardens that we so love to visit, and I feel like a couch potato. When thinking about the future, I worry about my health, I worry about my mortality. Last year, my kidney disease reached stage 4, only one short step away from kidney failure. What had eluded me for so many years had seemingly arrived, and I felt helpless to reverse this downward trend. What can I do to fix this? Nothing, say the doctors. Take your blood pressure medicine, eat healthy, and exercise. Hope for the best, plan for the worst. How can I support my family if I'm on dialysis every day, or worse? Sure, we all may be able to adjust to a new norm, but how far do we need to adjust and still maintain productive lives? I recall an old saying, living with the plague is pretty awful, but you get used to it after a while. Thank you for the opportunity to present my testimony.
My name is Brian Ranking. I'm 31 years old, living with Alport Syndrome. However, my experience might be a little different than the usual. I wasn't diagnosed with it until early 2016, after 6 years of guessing, of trying to figure out what was going on. Being 29 at the time, I was sort of might be a little bit older to just be discovering this and finding out what's the problem. The real obstacle was nobody in my family has it. It appears that I am the first to develop this. That coupled with it being rare on itself made it difficult to pin down. I really don't have many symptoms that most people do, which can also contribute into the difficulty of diagnosing. My hearing's normal, my vision's normal, and honestly I felt pretty fine up until recently, I guess. My only displayable symptoms were proteinuria and hematuria, and it wasn't that bad to where it was obvious to me that there was an issue, so again it went unnoticed for a while. Since those have really been my only symptoms, the impact on my day-to-day activities has been minimal. I still work 60 hours a week. I go to the gym a few days a week. I play on 4 different soccer teams 3 nights a week. I go skydiving here and there. I go out regularly. I'm pretty active. The only real hindering symptom that I've come to see recently is just fatigue, being tired. And that's only been a hindrance the past few weeks. I mean, it hasn't been that bad until recently. I'm worn out. I'm tired a lot. But I don't really let it try to stop me from doing what I want to do. I keep obviously going to play and do everything I'd like to until recently. In June, my GFR hit 19. That's when I kind of started to notice I've been more tired than I had been usually. I've noticed my body just doesn't recover as well. I get through a day of work, I'm worn out and just ready to collapse and go to bed. I've been going to sleep at 6, 7, 8 o'clock at night, which for me is super early. I normally play soccer on Monday and Wednesday and Saturday nights. Monday nights playing twice in 2 games in a night. The second game is becoming more difficult to play. The past few weeks I've stopped playing the second game. It's been a struggle just to make it through one because I start to get so tired. I can feel my muscles just getting exhausted by the second half, and it's hard to continue. By the time I get home after the game, once I sit down, I'm pretty much done for the night. I don't want to get up and move again because I'm so exhausted. It takes all of Tuesday to try to recover enough to go play again on Wednesday, and it's to the point I'm missing games because I can't recover the way I used to and do everything I used to. As of now, I'm going to try to drop a couple of those teams and stop playing as much to try to allow me to recover for the ones I can still play and perform as well as I'm accustomed to. I've tried different things to try to help the recovery, missing more games, rest, different stretching techniques, more hydration, but nothing really seems to work. It's just my body can't handle and recover from all the activity that I normally do. Yeah, even my last skydive, I had a particularly slow canopy that opened and gives you the least amount of impact felt, but I was so extremely sore afterwards, which typically I wouldn't have been in the past. It's just not holding up to what I'm used to doing. And as of now, that's really my only restriction or limitation. I fortunately don't have to miss work, and if I just don't do anything, I feel okay. But for me, not doing something and just sitting isn't something I can do well. I like to be active and keep moving. I typically have done whatever I've wanted to do. To have that taken away, even in just these small examples, is difficult. And to make it worse, there's nothing I can do about it. There's currently no real treatment for the disease itself other than managing the symptoms and trying to do the best you can with that until it's time for transplant. My hope is that in the future, from things like this, there are treatment options available to treat the disease itself to try to avoid some of these symptoms and hopefully prevent the impact that the disease can have on daily life. Thank you.
Hello, my name is Janine Reed. I'm a retired dialysis nurse and I have X-linked Alport Syndrome. This disease has affected my family for more than 100 years. In 1915, my great-uncle's suicide by gunshot was memorialized in an obituary that states he was also known to have suffered from Bright's disease, an old term for kidney disease. In 1959, 2 maternal uncles died of kidney failure, and a few years later, my mother underwent an evaluation for chronic hematuria, which was misdiagnosed, never monitored, and she progressed to stage 4, but died of other comorbidities. After I finished nursing school in 1974, I was diagnosed with Alport Syndrome due to hematuria, proteinuria, and our family history. My diagnosis was confirmed by skin biopsy and later by genetic testing during my participation in the Athena study. I have 4 adult children. Each pregnancy caused preeclampsia symptoms and renal progression, which remained after each birth. My second son was born by emergency C-section at 37 weeks and was a compromised newborn who did recover but spent his first week in a neonatal ICU. My last pregnancy included 6 weeks of bed rest and an induced VBAC at 37 weeks as my renal function had declined further, and we didn't want to risk another compromised baby. Each pregnancy was more challenging than the one before, so I made the difficult decision to not have more children as I wanted to be as healthy as possible to raise these 4 beauties. Plus, I didn't want to risk passing along Alport Syndrome to other children. My 3 sons and 3 grandchildren are monitored for early signs of Alport Syndrome, and so far, none are affected. My daughter has inherited Alport Syndrome and has mild symptoms. We eat a low-protein, mostly plant-based diet in an effort to delay the progression of our symptoms. Counting grams of protein is a daily reminder of having this disease. I'm in CKD stage 3 with a GFR in the 40s. My symptoms include hematuria, proteinuria, fatigue, and hearing loss. I also have dot and fleck retinopathy, which is associated with Alport Syndrome, but does not affect my vision. My hearing loss was identified in 1997 during a routine employee screening. I delayed getting hearing aids due to the expense, but my hearing loss caused increasing difficulty for me to communicate effectively at home and at work. I found myself avoiding social interactions rather than misunderstand what someone was saying. I would get lost in a conversation and would frequently resort to a smile and a nod when actually I didn't know for sure what was being said. I've worn hearing aids for 3 years now. They do help, but work best if others are willing to understand and accommodate how they function. I had to bear the $6,000 expense out of pocket, and now that I'm retired, I'm concerned about how I will cover that cost at a time when they need to be replaced. Managing my hearing loss is another continuous reminder of having Alport Syndrome. I make every effort to continue with an active lifestyle that includes beekeeping, gardening, genealogy research, hand spinning, quilting, and walking, running, or bicycling several miles each week. I take lisinopril to delay my renal progression. Dosing is a daily juggling act, as I typically have a normal to low blood pressure, which can drop so low it affects my ability to carry out daily activities comfortably. In addition, I find that I'm frequently too fatigued to continue with an activity I've begun. I might have to stop gardening after a few hours, be too dizzy to fix a meal, and keeping up with our little farm or just jumping on my bike for a ride may be too much. I've always been a strong, dynamic woman, but I can see myself moving towards a slower pace, which is very frustrating, and not the example I want to set for my children and my grandchildren. My hope for our family is to have treatment options that will delay the progression so we can avoid dialysis. Thank you for giving me this opportunity to share my family's Alport story with you in person.
Hello, everyone. My name is Sharon Lagas. I'm 57 years old. I live in Phoenix, Arizona, and I'm a geologist by training. I co-founded the Alport Syndrome Foundation in 2007 and have worked as a volunteer ever since. I am one of 3 generations and one of 7 family members affected by X-linked Alport Syndrome. I have 3 children, 2 boys and a girl, and my 2 boys inherited the disease. It was absolutely devastating to think I'd pass this disease on to my boys and would have to relive the challenges that I watched my younger brother go through during his life. I was afraid that my boys would experience kidney failure by the age of 16, have to do hemodialysis during high school, and endure the extreme side effects of immunosuppression and pass away at an early age. That was my brother's journey. As you can imagine, the most significant impact of Alport Syndrome on my life is emotional stress. I worry about my reduced kidney function and my boys' progressing proteinuria, wondering when one of us might have to start dealing with the effects of kidney failure. This constant stress impacts every aspect of my life if I don't take positive steps to try and manage it. I have trouble sleeping, heart palpitations, headaches, and it's not good for relationships nor family dynamics. I have to work hard on a daily basis to remain positive and to choose to be proactive and not live as a victim. Physically, on my best days, I have sustained energy throughout the day, allowing me to do the things I love most, such as exercising, hiking, and socializing with friends. Because of my reduced kidney function, I tire more easily than my peers, and some days don't have the energy to do the hike that I easily did the day before. I become short of breath and dizzy and need to return home. I have to work hard every day to make sure that my kidney disease does not take over my life. On my worst days, I can experience extreme fatigue, severely limiting my daily activities. There are times that I felt too tired to make dinner for my family or bring my children to their after-school activities. I felt very depressed that I could not fulfill basic responsibilities for my family. Other impacts to my day-to-day living include unexplained inflammation. I have high inflammatory blood markers and experience symptoms regularly of fibromyalgia, muscle pain, swelling, and longer recovery times from exercise than others. I've had 2 severe episodes of knee swelling with a fever that kept me from being able to walk and even required me to leave a family vacation early. I went to the ER and various doctors, and no one could ever find a cause, and it wasn't because of an injury. My symptoms have continued to worsen over the years, and I now need to take more and more medication. I take 13 pills every day, including losartan, allopurinol, and Crestor. My proteinuria has been slowly increasing along with my uric acid. Luckily, my creatinine has remained stable around 1.4. My chronic kidney disease has also put me at very high risk for cardiac disease, based on a recent CT scan of my coronary artery showing significant calcification. This makes me very fearful to push myself too hard and very fearful for my future. I'm a female with X-linked Alport Syndrome, often ignored by the medical community as the carrier of the disease and not thought to progress to renal failure. We now know that this is not correct. In fact, my last estimated glomerular filtration rate was 41 milliliters per minute, but has varied from 39 to 64 depending on the test or calculations. This is an obvious cause of concern for me, not knowing exactly what my GFR is and exactly where I am in my progression of my disease. My kidney disease severely impacted my pregnancies. All 3 of my children were born preterm, 5 to 8 weeks early. I experienced preeclampsia with the pregnancies of my boys. One of my boys was only 3 pounds at birth and spent 3 weeks in the hospital before he could come home. Preeclampsia caused me to retain large amounts of fluid so that my face was almost unrecognizable. You can see in this photo. And my feet swelled from a size 7 to a size 9. It made me feel extremely fatigued, lethargic, and very weepy. My blood pressure shot up to 200 over 100, and my organs started to shut down, so they induced my son at 32 weeks. I lost 10 pounds of fluid every night for several days after my son was born. It was an extremely traumatic experience for me and my family, but we were very lucky. I'm an Alport patient, but I'm also a mother of 2 boys with the disease, and this has been very challenging. I feel the pressure to ensure that they take their medication, eat well, get to their doctor's appointments, and live a healthy lifestyle. This is hard as kids want to know why they can't eat Frito taco pie on Tuesday night like their friends and play tackle football. They don't want to hear that I'm trying to manage their sodium, potassium, phosphorus, and prevent any trauma to their kidneys. They just want to fit in with their peers. I'm also sad to see what this has done to their sister, the lack of attention and her feeling the pressure to donate a kidney, worrying that she only has 1 kidney to give but 2 brothers who will need it. I am thankful that my boys are now 22 and 23 years old and still have their kidney function. I want this to continue as long as possible and not see their plans for graduate school or medical school get derailed by their disease. I also know that every year they remain off of dialysis or immunosuppression allows them to lead a longer and healthier life. Thank you very much for listening to my testimony.
And please join me in a round of applause for the whole panel for being so brave and sharing their stories.